So again, and I don't want to come out the gate sounding opposed, but we have to answer a lot of questions to our community members. So one, Marlon, I know Supervisor Andersen asked this, but are there statistics that show those people that lift themselves out of poverty through our public benefit? I know anecdotally that there are those who face divorce or medical crisis or whatever that find themselves on public benefit, but then lift themselves out of that situation and beyond. And nothing being equal here, right? But are there statistics that show that the safety net that currently exists lifts people out of poverty?
So that's an excellent question that I have asked myself a lot. There's not a lot of research out there, because to know that you have to track people over a long time, and there's really no researchers who have the capacity to do that for a long time. So for instance, for CalWORKs in California, we track CalWORKs exiters for 2 years and their income for 2 years, and that's pretty good, but that's really the kind of the best that there is nationally. There's just not long-term studies like that can follow people so long. I will say though that you know, I mean, there are I'll leave it there.
So a lot of these GI programs started during the pandemic. They're funded through ARPA. How is the next step? That money is gone. So now what's our next move if these are going to be sustainable programs? I'll take that from anyone.
For sustainability, yeah, sustainability is going to come from the state. And
well, what was the state's investment so far? Because I heard it mentioned earlier, the state has made an investment in GI. What is that?
You know what that total is? 25? Yeah, like $25 million across the state in different pilots. And you know, the work that we were doing at the state level was with AB 2263, right, which was a guaranteed income study bill, which was basically designed to create an 11-member coordinating council at the state level with policymakers, advocates, participants, practitioners, to look at all of the pilots that have gone taking place across the entire nation, to look at all that wealth of data, to really look at how can we best implement guaranteed income, the first guaranteed income program here in California. So we're looking at, you know, priority populations, we're looking at funding sources, and we're also looking at the first priority populations across the state as well, so for that first permanent state program. And so my hope is that we can have, because I know Los Angeles is going to have folks on that council. I know that Santa Clara is going to have folks on that council. I'd like Contra Costans to be on that council so that we can help shape state policy as well and make sure that this is the rollout for the state program will positively affect folks here in Contra Costa County who need the help most, and it can be that permanent program that we're looking for.
29% of the population here in Contra Costa is using one of the safety nets, is that correct?
Correct.
So I just did a quick math, and that would be about 348,000 people if we have 1.2 million people, just kind of giving people an idea of what I'm doing. So I think, so the ask is that we appropriate $5.75 million to a program. It would provide $1,000 a month for 18 months. And so that would be a total of $18,000 per person, household, however you want to put it. And so if we divided that into 5.75, that would be 319 households. But I think the last time I asked this question, there was a different number. So there's money that would be included for the providers to do something, is that correct?
Yes, so there would be, some portion would go to EHSD for oversight and administration of the pilots, because we all know that it takes work and that labor should be paid for. There would be an additional allocation to the community organizations, community-based organizations that respond to the competitive RFP process, so that also takes labor and expertise and time and resources to implement the pilot. There's funding baked into the EHSD allocation for the evaluation of the pilot, so that's kind of built in. And then what's the other? Oh, and then there's the direct payments, of course, to the folks participating. Yes.
So how many people are you expecting 5.75 million to be able to participate?
The number in the report is 250 people.
250 people.
Yeah.
Okay. So the thing that I've said this, the thing that I am concerned about is the cliff. You know, when they get to the end of that period, what happens? The second part of it is that earlier today when we were talking with the food bank, they said that they could create 3.2 million meals from $1.6 million. So my question is, when we talk about the folks that we want to help, foster youth, unhoused and unstably housed, reentry, families with young children. I didn't see seniors in there for some reason. Do we have 250,000 people? 200 people that we're going to pick out of all of those people that need help? How do we do that?
Does anyone else want to talk? Anyone else want to respond?
When we started our pilot, we were starting with a very small, and we knew we could only help 30 participants in our pilot. We have way more folks in our group than that. And so that question that you're asking is a question that every pilot implementer has asked and still moved forward with their pilot. Okay. The same with the question about what happens once the pilot ends. I've been asking people who have run much larger pilots for a lot longer, what happened when your pilot ended? What did your participants do? And the answer is universal. They keep living. Mm-hmm. It wasn't a surprise. They knew that the funds were going to end, and they planned appropriately.
But was their lives improved is kind of what I would hope is, you know, did they get better financial literacy, or, you know, did their credit score go up, or was there you know, I would love to see that.
Supervisor, if we could respond to that point
Yeah,
you just
go ahead.
made, if you want to talk about what's in the report. Well, so in the report, there is actually extensive data, and again, I know it's a long read, so we encourage you to go back through it, but there is actually extensive data showing that folks do elevate their lives in ways that are sustainable.
For how long?
Even just the capacity to reduce predatory debt and build savings and open a checking account, those are long-term and sustained benefits.
Yeah.
I mean, just to name one.
Totally agree.
Okay.
I'm looking at the way we're looking at taxpayers' money, people that have given us the responsibility to leverage it to help the most people and to make the biggest difference. And so that's what I'm asking, is I'm trying to figure out how we can make the biggest impact on someone, longest term stability or whatever that is, or the most people, and kind of have that balance there. And so those are why I'm asking those questions. So going back to what Marla said, we have 348,000 people that are getting services right now. And if we were to give each one of them, you know, put them into this pilot, it would be, I think, if my calculator works right, we'd need $6 billion just here in Contra Costa. So I'm concerned because I feel like I would really like to see the state or federal government take a stand so that we could help disperse it. I feel like once we make a commitment, it's hard for us to step away. Let me ask one more question. For those that participate in pilot programs, do they continue on, or do they get stopped and they are not qualified to get back in?
So I think the answer is the evidence from the pilots that have been done, 150, you know, nationwide to date. So that's a lot of people and a lot of evidence. Is that they're getting the opportunity for these transformative shifts in their own well-being through having predatory debt go away, having a savings account, getting a college degree, going to that training program that they couldn't do before because they worked 3 jobs to pay their rent, being able to be with their families more so the children start to benefit, the entire household benefits, right? And so it would take an enormous investment of funding, sort of like Ms. Stewart said, to track sort of over, like, we would all love to do that, and we have not yet had money fall from the sky to do it. However, we can look and extrapolate from the early evidence, and it's actually not early evidence, this has been many years now, far before 2020. I mean, Dr. King, Martin Luther King Jr. was talking about this in the 1960s, right? And so there's been decades, actually, of efforts and pilots and research, and it's just really amped up tremendously since 2020 is the way to kind of think about it. And so I guess the other thing I want to say is, you know, I'm a taxpayer, we're all taxpayers, everyone in this room today is a taxpayer. So I just want to be careful that we hold that term with inclusivity. And so, right, and so all of us as taxpayers, of course, want to see our tax dollars invested rightly and justly and well. And so for me as a taxpayer, and I hope for you as a board, when you look around in this land of plenty in this county and see people struggling and literally on street corners, it's like, I am super grateful for our safety net system. I personally have a history of receiving public benefits. It helped me get through college as a single parent. I know. So I'm never one to criticize that baseline, that floor, as Ms. Stewart mentioned. And also, the evidence of that not being quite enough is all around us, literally. That's evidence. So how do we take that floor and build on it with guaranteed income to invest not just for a little bit to everybody, but to actually be really strategic, really intentional, and very based in values of inclusion and belonging? How do we invest in just, you know, like I wish we had, right, $100 million, and we don't. We're asking for 5.75. It's a drop in the bucket, and also it's a lot. Like, both those things are true. But how do we take what we do have and really work with it in strategic new ways to help lift up not just those 250 households, but again, their neighbors, their communities, just the opportunities I think are really, the data is showing, are just going to be there and going to magnify and amplify in ways we can't even measure yet. But there's been enough discussion in the field that we know it's real.
Okay, so I'm going to...
But the question was, what happens at the end? Do they continue or do they actually stop?
So most GI pilots are time limited by design for both financial reasons and other reasons. And
I'm going to sort of follow up to Marla. And the question Diane had was, so what happens when a program ends? And I, Rachel, I loved your report. I read the whole thing. It's, you know, while people were experiencing that, yeah, they were feeling happy and good, and it's great. For some of us, though, it's what happens at the cliff. And Marla, I know we charged you with telling us what happens. And what I understood you saying to us is that there wasn't data showing at the end of GI programs, the data clearly showing that people had an increased benefit or were continuing on an upward trajectory, sort of what I gleaned. So I don't want to put words into your mouth, but I know your slide said it was really inconclusive as to what the benefit was for those who then dropped off the cliff. And I hate to call it that way, but where their payments ended, they were no longer receiving that.
Thank you, Supervisor Andersen. I have 3 responses here. First one is the long-term benefits of guaranteed income have not been demonstrated yet because there hasn't yet been the time for that demonstration. 2, there was an earlier question that I couldn't answer very well about what happened, like how often do people come back on? I have several staff watching, and one of them sent me an email with one answer to that, and that is that in California, I told you that we track CalWORKs exiters for 2 years, and after 2 years in Contra Costa County, 19% return to CalWORKs, so 80% do not, 81% do not return within 2 years. And then the third thing I wanted to say is for CalFresh and CalWORKs, they're designed not to have a cliff. So as a household's income goes up, the benefit comes down until the benefit then is like $10 or $20 at the end of that.